The new disease was even given a name, EMS. But a big question remained. Was the supplement itself dangerous, or was one batch simply tainted? The outbreak diminished when L-tryptophan was taken off the market, supporting scientists' suspicions of recent contamination. But investigators were increasingly puzzled. There seemed to be no relationship between the amount or brand of L-tryptophan a victim took and how sick he or she became. In certain cases, one spouse had become sick and the other not, even though they took the same doses from the same bottles. Moreover, previously unexplained cases of EMS dating to the early 1980s now were linked to L-tryptophan. Part of the explanation soon became clear. In the United States, L-tryptophan pills are made from raw powder imported from 6 Japanese producers. Sometimes U.S. manufacturers combine powders from more than one source and distribute them under many brand names. So a contaminant could show up in several brands. As far as researchers could determine, most people got sick had taken pills from the powder manufactured by Showa Denko KK, one of Japan's largest petrochemical companies. Using high-performance liquid chromatography, a process that detects molecular differences among chemicals and displays them as peaks in the graph, scientists isolated about 40 substances in the powder, in addition to L-tryptophan. One of these, called peak E, is strongly suspected of being the contaminant. Elevated levels of peak E began to appear about the time that Showa Denko made several changes in the manufacturing process, including purification procedure, alterations, and an introduction of a new strain of genetically engineered bacteria. Some researchers think the contaminant somehow caused T cells, part of the immune system, to go out of control in certain people. The result was EMS. And we would learn then to be an autoimmune disease, in which the body's immune system attacks its own tissues. Many scientists theorize that a host factor affects the degree to which patients react to the contaminant. Studies are also still underway, both to pinpoint the cause and to find a treatment or cure. Meanwhile, by mid-January 1,542 cases of EMS had been reported, and 28 people were dead. The final toll will not be known for years. Some victims recover initially, only to die from it later. Others become paraplegics or quadriplegics. All survivors share one question: how could this happen? In the early 1970s, researchers studied the use of L-tryptophan to treat insomnia, depression, and other disorders. Soon, they were reporting the supplement's success against premenstrual syndrome pain, and the range of mental problems side effects seemed minimal. By the 1980s, reports about L-tryptophan had reached the popular press. Books and articles touting the supplement as a treatment not only for insomnia and pain, but also for high blood pressure, high cholesterol, and obesity. It was now recommended by gynecologists, psychologists, and psychiatrists. Unlike drugs, however, L-tryptophan had not been clinically tested for safety and efficacy by the FDA. It had been classified as a food and did not need FDA approval. Because L-tryptophan is not a drug, manufacturers and retailers were prohibited from selling it as a treatment, cure, or prevention for a disease. While no medical benefits went on the label, sellers did make therapeutic claims in ads and articles. One flyer from L-tryptophan marketer Shift Products